In 6 days, Pfizer's COVID-19 vaccine will go before a key group of scientific advisors to the FDA. Our ABC 10 News anchor Derek Stahl is going in depth to explain how a San Diego doctor will cast an important vote.
Dr. Mark Sawyer is an infectious disease specialist at Rady Children's Hospital. He's served in this advisory role to the FDA before, but the stakes have never been this high.
I mean, this is a tough decision. We're weighing the benefit of a vaccine against the risks, and with any new product, we don't know all of the risks, and we have to just estimate based on the data we have.
Dr. Sawyer says he just got his hands on that all-important data from Pfizer's full phase 3 trial a few hours ago. He's one of the first people in the country to review it because he'll be one of the 20 or so members of VRBPAC. That's the Vaccines and Related Biological Products Advisory Committee.
The FDA counts on this advisory committee to be an independent group of people who are looking at the same information they looked at and asking us what our concerns are or whether we reach the same conclusion that their staff have reached.
After a preliminary meeting in October, this committee of independent doctors and scientists will gather again virtually on Thursday to publicly vet Pfizer's safety and efficacy data. At the end of that meeting, they'll vote on whether to recommend an emergency authorization. It comes at a time when surveys show just 60% of Americans feel comfortable getting the vaccine.
I do think that's going to change once this committee meets and the data is made public and we can all talk together as a community about what we know about the safety and what we don't know, frankly.
Dr. Sawyer was a member of VRBPAC for 4 years and the acting chair in 2017. The committee meets a few times each year to make recommendations on the flu vaccine and others. Their job is to issue a recommendation as outside advisors, and the FDA can overrule it, but it almost never does. From 2003 to 2019, VRBPAC made 105 recommendations and just 6% were overruled. That means when the committee votes on Thursday, it'll carry a lot of weight. And Dr. Sawyer says they'll make a decision based on all of the knowns and unknowns.
And we're weigh that against what we're going through right now. Our hospitals are getting overwhelmed, our ICUs are getting full, so we really need to do something to intervene, and the vaccine is the best thing we've got going.
The advisory committee meeting on Thursday is expected to last 9 hours. The FDA is expected to issue its final decision shortly after that, possibly the same day. Derek Stahl, ABC 10 News.
Pfizer says it can begin distributing doses within hours of the FDA's decision. The advisory committee will meet again on December the 17th to discuss Moderna's vaccine candidate.